But if you say about purulent inflammation, maybe pus. Yes, beautiful green, yellow fluid. Yes, in this situation only another color. Yes, more often for serous or catarrhal inflammation. Microscopically, you see this picture. In this situation, yes, you see this epithelium of the trachea, yes, but without injury. In your microscope, you see severe forms of tracheitis, severe forms of influenza, and you see injury of the cells. You have area without epithelium, yes, bare basement membrane. You see only this is vessels, yes, because all of the inflammation with hyperemia of blood vessels. You remember, this is glands, yes, maybe hypoplasia, and this is beautiful cartilage, yes, and some muscular part, yes. In your situation, you see damage, injury, yes, and proliferation. Proliferation, you see this, for example, yes, you see a lot of cells in one part. Proliferation, injury, and tracheitis. If you say about this is, for example, you see again lungs. Yes, for severe forms of the influenza, you see damage of the lung, especially, and you see pneumonia. For influenza, for viral infection, you see hemorrhagic pneumonia. Hemorrhagic because you see red blood cells, yes, prevalence of red blood cells. In bronchus, for example, in this part you see red blood cells and purulent neutrophils. But main hemorrhagic inflammation, serous hemorrhagic or hemorrhagic. But all of us remember, influenza with immunodeficiency. And patients with flu may be together with bacterial infections. And you see purulent and hemorrhagic inflammation. This is lungs. For example, you see some parts with hemorrhagic inflammation, some parts with pus. This is beautiful yellow and or green maybe, yeah, sometimes together. And you see hemorrhagic pneumonia and purulent pneumonia and abscesses, yes, you remember. And if you see this picture, this trachea, you see some part with purulent, yes, it's maybe small area with pus. And this pneumonia microscopically, hemorrhagic, suppurative, hemorrhagic, suppurative, together. Why? Because all of the influenza may be together with bacteria, yes. First time maybe influenza, but through a few days, week, you remember about streptococcus and maybe together bacterial and viral, in this situation, pneumonia. With conjunctivitis maybe, especially for influenza, and adenovirus maybe conjunctivitis, increased temperature, and a lot of non-specific symptoms. But you remember, if you think about influenza, for a lot of people maybe without problems. Yes, you see intoxication, but through 7 days life again good. But every year you have death. Yes, not only after corona, maybe after influenza, but students with vaccination. Yes, all of them after vaccine. Yes, influenza, maybe through a few weeks, maybe with corona, yes, vaccination, yes, and go to Sri Lanka. Without vaccination, it's impossible, or maybe.
But
quarantine. Quarantine.
2
yes,
weeks.
Quarantine.
With vaccine, no need quarantine.
It's not maybe 2 weeks with quarantine, and maybe.
Домой.
And okay, interesting. Okay, last class. Discuss something. Yes. This is what this. Only diagnose. Okay, who's specialist in our group? Lobar pneumonia. Gray hepatization. Yes. Pleuritis. Yes, this is bronchopneumonia with abscesses. Yes, patches with abscesses. What's this? Black, beautiful
lymph
lymph nodes with
coldus.
coldus. Okay. What's this? Pericarditis. Bread and butter pericarditis. Okay. Okay, but haven't Banamuna. What? Banamuna?
Bakamuna.
Bakamuna. Okay. Bakamuna. Haven't Bakamuna only histologically. If you think about last classes discussed species, Bakamuna. Okay, what's this? Abscesses of the brain. One or a lot? Multiple abscesses of the brain. Okay. Last class discussed species, for example. Beautiful lungs again. Yes, you see some. If you see with attention, have a lot of whitish spots. Yes, look like with millet seeds. Zerna prosa. What's this? It's miliary TB. Today TB maybe or not? Why? We'll discuss TB. Who's remember?
Secondary stage is not present now.
Secondary stages of
TB not present because of the medications. No?
yes. If you say about TB today, maybe why again think about TB today? Today because you have influenza, parainfluenza, respiratory adena, and HIV.
Infections.
Why TB? TB have TB. It's virus or a bacteria? Bacteria. Okay. But why discuss and think about TB?
Secondary complication.
Complication of influenza?
No, HIV can cause
Yes,
death.
HIV, because it's opportunistic infection. You remember about co-infection. It may be interesting together, yes, family, yes, maybe HIV and TB, yes. Maybe more than 13 patients with HIV together with TB. No, it's good or not good. If you say about tuberculosis, opportunistic infection in patients with HIV, maybe stage AIDS, yes, last stage, miliary TB. Today, oral disease, again, you see lungs, but not miliary because you see cavity, cavernous TB. And this is beautiful, yes, if you see with attention, maybe look like with cheese, yes. This is, what is cheese in? Caseous necrosis, cheese-like necrosis, this is, yes. And cavity, it's secondary post-primary tuberculosis. Okay, last class discussed this is, what's this? Carcinoma of the lungs, yes, it may be central or peripheral. Yes, central. Central, yes, central. It's the damage of big bronchus, yes. It's invasive or expensive? Invasive. It's exophytic or endophytic? Exophytic or endophytic, what? Exophytic. It's okay. Exophytic, invasive, yes, gross, central localization. And histologically, what types? It's not pathophysiology, yes?
Squamous cell.
Squamous cell carcinoma. You remember about good game, yes, with one life, yes? Good game. If you say about squamous more often, but maybe another, decide only after microscopical investigation. If you say about VCs, what's this? It's brain, yes?
The gyri has reduced.
Yes, and you say this is reduce of grain, it's maybe normal. For some people, maybe 1 kilogram it's okay, for another, maybe near 2 kilogram,
No, so
but
the
it's not necessarily a big problem.
sulcus and gyri have decreased.
Yes, you see this is whitish, beautiful, during autopsy maybe green or yellow, and your diagnosis? Meningitis, purulent meningitis, especially after lobar pneumonia maybe, or after next week maybe discuss meningococcal infections. Yes, next week discuss diphtheria. Next week not dysentery because dysentery discuss, and measles. Measles. It's maybe childhood diseases. Next week childhood diseases. Childhood. How many slides today?